Okay, well, I wanted to start off this year by talking about the paediatric curriculum and about paediatric training this year, and talk about the content of the curriculum and how to learn about pediatrics. It's an overview talk that I want it to be informal. So please, if you've got questions, please raise your hand, or we can talk at the end of it. But I'm going to talk a bit to start with about the School of Medicine and Health Sciences pediatric curriculum, and about the training program in general for this year. And I hope that's going to be useful to you, either as candidates yourselves or as supervisors or mentors of postgraduate trainees. So I'll just make a start here. I want, as I said, I want to outline the pediatric training curriculum, and I want to describe the many ways in which we can learn pediatrics. It's not just one way. There's a multitude of different ways we can learn about pediatrics. I'll say something towards the end of the talk about supervision and mentorship and teaching, and how they're similar and how they're different, and how all trainees need a supervisor and they also need a mentor. And it might be the same person, but sometimes it'll be a different person. And I think you need to be very proactive in asking people if they'll be your mentor throughout your training. A good mentor will follow you for most of your training, for the whole 5 years of your training, and they'll help you in a variety of different ways. And then finally, I just want to say something about the duration of pediatric training, and how it's not a sprint, it's a marathon, and you have to really pace yourself along the way. But let's talk about the pediatric training curriculum. And what it's and first of all, I want to start off with by what it's trying to teach you. The diploma, as you know, the entire pediatric training program includes the first year, which is the Diploma of Child Health, the DCH, and we have this year, I think, 8 DCH candidates enrolled. And that's really training you to be a good clinician who can look after children, to be not to be necessarily a pediatrician, but to be someone who's a good basic clinician who is competent in looking after children in a district or provincial hospital. We hope that most of the DCH candidates will go on to the Masters of Medicine, and the Part 1, which is the second year, teaches you the basic sciences behind the discipline of pediatrics and child health and medicine in general. So you need to cover both a lot about pediatrics and child health, pathology and pathophysiology and basic science, but also about more advanced medicine in general, the basic sciences behind that. That's for 1 year. And then the Part 2 is really about developing skills to be a good pediatrician. And they're not just disease-related skills. Of course, you need to have a detailed knowledge of pediatrics, and you need to have good clinical skills, but you also need to have deductive reasoning and problem-solving skills. You need to develop professional skills like ethics and teaching ability. You need to have a good understanding of public child health as well as acute hospital pediatrics. We'll try to teach you along the way about acute and intensive care pediatrics and other specialties, cardiology and oncology and respiratory medicine and neurology, etc. You need to have a good understanding of chronic care, because more and more of the children we look after are not just acute hospital patients, but they will need to follow them longer term because they have some chronic illness that affects their lives. More and more pediatrics is about chronic illness and the transition between acute illness and chronic illness. And I think to be a good pediatrician, you really need to have those, chronic illness management skills. We'll talk a lot about that this year. As well as that, during your training, the 5 years of your training, you should progressively develop procedural skills. From the start, it's how to insert intravenous drips, and then it goes on to other things like how to do ultrasound or echocardiography, or put in central lines to resuscitate and intubate a patient. These are procedural skills that there are certain things that if you're a good general pediatrician, you'll have a good understanding of. And some of these procedural skills, like learning about ultrasound or learning about echocardiography, are relatively new skills that pediatricians need to have. And you don't need to think, how am I going to learn all of this? It's really, you've got 5 years to do it. And so I would encourage you to think about the procedural skills that you want to master over your training. As well as that, I mentioned about professional skills, and I think research and an understanding of research and child health epidemiology is very important if you're going to be a good pediatrician. And as I said, teaching, the ability to re-impart the knowledge we have, to teach other people, to know about the principles of adult learning, not just classroom lectures, but the principles of adult learning are very important skills. Now, it might seem daunting, all of this to be done, to be a pediatrician, but you've got 5 years to do it. And so I think we can, as I said, it's a marathon, not a sprint. But if you're aware of all the things all the skills that you aim to acquire in that 5-year period, most people take 5 years, then you can be much better prepared to do so. The pediatric curriculum, these are the lectures that I gave in 2023, with 1 or 2 added to it, and there's a few more on top of that. I won't go through them all now, but all those lectures are available on YouTube. You can go back and look at those. I'll be repeating some of these, but I'm also this year going to try to introduce some more lectures. So I'd encourage you to go back and look at I think there's 35 from last year. And at some stage, just go through those lectures. Some of them I will repeat for the common essential things, but many of them, I can't say it any better than I did in the earlier lecture, and I'd encourage you to go back and look at those. We will start with today the overview of the curriculum. Next week, we will talk about the deteriorating pediatric patient. I think these are fundamental things that you need to learn at a DCH and a master's level. We need to be really good at these things. Some of the other disease-specific lectures, they are already online, so you can go back and look at those at any time. I'll show you the link to those towards the end. But as I said, the weekly lectures, this is the link, but I will show you actually what the website looks like. There's 83 lectures in total, but about 35 in the overall series. Some are repeated, so you don't need to watch every year's worth of these. The pneumonia lectures, for example, you can watch the latest one in 2023. So this year we'll add some Part 1 basic science lectures, because I think there's a need to be teaching a bit more about the basic sciences as a background to clinical pediatrics. We'll incorporate that at some stage. Now, I just wanted to say something about how many ways there are to learn pediatrics. And I think, again, you need to build on this over time. You might think that the best way to learn is to sit in a lecture and have someone lecture to you. I don't think that's a very productive way to learn by itself. And you need to augment any learning you do from lectures with lots of other different modalities of learning. That's the way adults learn, and kids and children. They learn because they're exposed to a multitude of different stimuli that are rather similar, and they're on similar topics. So we learn the most at the bedside we learn from our patients. We learn from reading around the conditions that our patients have by becoming experts in the management of the conditions that our patients have. I think you can carry a guideline with you and refer to it often. I think it's really important, even now I carry a guideline that I like to look up to make sure that, one, my treatments are right, that I've, learned everything I can about the condition. You can attend the weekly lectures. I hope you will. We'll have them on Monday at midday, unless that's a difficult time for people, and then we can change them. I'll talk about this, but at some stage, you need to start at the start and go to the end of a paediatric textbook. I'll talk about some of the textbooks that are useful to read, that are manageable. I think that you can read within 6 months or a year from start to finish. There are some that are really thick and you wouldn't possibly be able to read them, but there are several good paediatric textbooks that you could read within a year or so. I think case presentations and discussions are really important. So that goes back to learning at the bedside, but it's also, as an extension of that, I think you should be practicing case presentations regularly. You can keep a logbook. I'll talk a bit more about that, about keeping a logbook of the procedures, the cases that you see, etc. It takes a bit of discipline, but I think you'll find it very valuable to be able to look back on your logbook and see what cases you've managed, what diseases you've looked after, and what procedures you've done, and what courses you've attended, etc. You can be involved in mortality and morbidity meetings. That's a good way to learn. I think we learn a lot from reviewing practice, from reviewing and questioning our own practice and trying to do better. So that's an important way to learn, and I think you should all be at registrar level, be helping to prepare cases for morbidity and mortality meetings, presenting the cases, trying to formulate the lessons that come from those cases, and then implement changes that are required to make improvements to your service. You can learn by teaching other people, and I think that's very important at all levels. If you're a Diploma of Child Health candidate and you've just started paediatrics, you can teach nurses or nursing students. If you're a senior registrar, you can teach junior registrars, or you can teach other nurses, etc. So I think we can always learn by teaching others. We can learn by teaching, giving tutorials to medical students. There's lots of people who are keen to learn, and you will get a lot out of it if you start teaching others. You'll gain more confidence, you'll get communication skills, you'll learn how to impart knowledge, and it reinforces the learning that we already have. I would, if you can, join a study group, and especially all the way, actually, along the way of your training, you try to put together a study group of registrars, mostly at your level, who can study together and learn off each other. You can learn by reading journals, and I'll talk about what are good paediatric journals to read. You can do your research project, that teaches you other skills, and then you can learn from online resources and podcasts. Now, in all of this, I haven't mentioned social media once, but there are very good online resources, and there are some very good podcasts on pediatric topics that you can learn from. So the point is that you need to mix it up. You need to be learning with a multitude of different ways, and then that really reinforces the knowledge that you have. If you just learn by just one modality, at least I can't remember much if I only hear it once. It's got to come through multiple different ways, and then I find I learn it much better. I mentioned we can learn at the bedside, and the first thing to learn is actually some clinical skills at the bedside. And I think the first thing to learn is how to talk to children. And some of us have got to be adults, and we've forgotten how to talk to children. And I think that's a shame. But as people who want to be pediatricians, you have to learn how to talk to children to make them feel safe, and to make them feel comfortable, and to elicit information from them. Now, mostly when we are taking histories, we think the history should be taken from the parent. And that's often what we do. And we often do that inappropriately in children who are school age or older. And I think even down to the age of about 3, you can get a lot of good history from talking to the child. Of course, you get the main history from the parent, but I want you to try to get good at talking to children as well. And I think there's a few basic things that you can do to make children feel safe when you have a clinical encounter, when you're seeing them on a ward round or seeing them in your clinic. If you have a clinical encounter of any sort, you can do certain things that make them feel safe. One is to ask them very familiar questions that they'll know the answer to, like, how did you sleep? That's often a very good question to ask children because it's something that's relevant to them. They probably didn't get much sleep if they're in hospital or if they're sick or if they're in pain or if they're nervous or anxious. And asking them that shows that you're caring about them. And it's also something that's really relevant to them. Are you hungry this morning? Have you eaten? These are basic things that children will have a familiarity with, even down to the age of 3, for example, 3 years of age, or certainly school age children. I often tell them the day and the time. So I say, it's Monday and it's 10:30 in the morning, or it's Sunday morning and it's still 8 o'clock. It's only 8 o'clock in the morning. You tell them the day and the time, because if they're old enough, because it helps to orientate them. And many children will, if they're older, will have a familiarity about the day and the time of day. But in a hospital, it's hard for them to understand where they are. So I tell them where they are, and I try to tell them, often tell them, well, it's Wednesday and it's 11 o'clock in the morning, so you'll be having your lunch soon, or saying normal things. You can talk to them about the weather. It's a hot day outside, or it's raining a lot, or these things that children will know about. Try to orientate them on their place and the time and the date. I always ask children about things I think they'll know about, like maybe ask them about their siblings, or what they like to do at school, or what sports do they play, what art, whether they like art or craft or some other activities. That also is, these are things that are familiar to children, aren't they? One of those things these children will know about, whether they've got brothers or sisters, what their names are, what their ages are, whether they might have a dog or a pet at home. These are things that children are interested in. So learn to ask these basic things. If children have made an effort to, like, have a bath or a wash, and they put on clothes, then I try to compliment them on their clothes, to say what they've got, wearing a nice dress, or that's a nice shirt you've got on today. Many children will have nail polish on. They might have done their nails because they're bored in hospital and someone's done that, or they might have, washed their hair or brushed their hair. Just compliment them on these things, because they're things that children will value. They value looking nice, and therefore they will value you to compliment them on that. It's important to reassure children that they're being looked after, and that if they are going to be, discharged home at some time in the near future, then tell them that, because they won't know. They might think they have to be in hospital for a long period of time. And then also ask them if they've got any questions at the end of the consultation. Now, I'm not trying to say you should ask every child all of these things at all. You should just, at an age appropriate level, think of 1 or 2 of these things and talk to children about. So just so as you can put them at ease. Now, I know I've laboured this point, but I think it is important that we learn how to talk to children in ways that make them feel safe, because hospitals can be very intimidating places. Next you need to learn how to examine children. And for some of you, this is Janelle Solomon, who was examining this little girl here, and any of you have seen me examine patients, I get down to their level and make sure you're at their eye level. not leaning over them on the bed. I mean, it's a tendency to either stand back and just talk over children or lean right over them. That can be very threatening, especially for for younger children who have stranger anxiety. It's quite threatening. If you examine children and get down to their level, you get much more clinical information. You can just also observe children at that level, and they'll be less scared of you. I think that it's the best way to examine children. It's very important though to don't strain your back when you're doing it. So you have to keep your back straight and bend your knees. I mean, these are basic things. They might seem basic, but these are clinical skills that you should learn. So get down to children. If you lean over them, they're much more likely to cry than if you get down to their level, like Janella is there. You should. We'll talk more about the pediatric examination as the year goes on, but you need to be opportunistic. It's not just like you would examine an adult. You need to be opportunistic, but be systematic as well. So you can't get away with not being systematic and doing a proper respiratory examination. If you do just cut too many corners, you'll make too many mistakes. So you need to be opportunistic, but you need to be systematic as well. And you need to try to be fun. I mean, it is fun examining children and talking to children and their families and trying to help them. And so you need to demonstrate that you are enjoying it and that your work is fun and you're pleased to be there and to be looking after them. As I said, we learn so much from our patients, and I think a place to start is to read around the diseases and the problems that you see every day. That can be you read a book, or you look up something online, a reliable source online, or you look at your textbook for that particular issue. You discuss cases together that between your colleagues and other trainees. There's two ways to read a book. One is to read from start to finish, and the other one is what we call opportunistic reading, where it's different to comprehensive reading, where you've read every chapter from start to finish. You're looking up things in the index and you're going to that particular section, and then you're trying to understand in depth that particular issue. And I think throughout your training, you need to do both things. You need to be an opportunistic reader, but you also need to be a comprehensive reader. I'll talk a bit more about that later on when I talk about textbooks. You need to learn how to do a PubMed search for specific questions. I won't go through that today, but we will in the coming weeks or so talk about how to do a PubMed or a Medline search. This is or a Google Scholar search. That's a relatively reliable search engine too. There are some quite reliable search engines you can use to identify, to answer questions. Or you can ask a professor or a senior for a tutorial on that topic of the patient that you're seeing in front of you. So learn at the bedside. I said that I carry a guideline and I try to refer to it often. There are several guidelines, as you know, the WHO Hospital Care for Children book and the P&G Standard Treatment book. You need to learn. I think it's good to learn how to use guidelines in everyday clinical practice, how to refer to them. It's not a skill that everyone necessarily has when they start, how to use a guideline in a comprehensive way and how to know how to navigate through it. But you can learn that. There are also some apps in pediatrics. There's the Hospital Care for Children app, which enables you to navigate through this book and find basic things. I said I'd talk about textbooks of pediatrics that you can read from start to finish. This is Practical Pediatrics. I'll just get it down here. This is how thick it is. So what is it? About 800 pages, which might seem a lot, but there are some textbooks of pediatrics that are some 2,000 pages, and that's really hard and very advanced. And so I think it's good to be using one of these books. When I looked at this recently, I thought probably the best one was the illustrated textbook of pediatrics. And I say best, not because the content is best, but it's the most current. So it's from the UK. It was published in 2021, so it's been updated recently, and it was the cheapest. So I could buy it from Booktopia or Amazon for 60 Australian dollars. Whereas the Australian book, which I think is excellent, it's a very good book. I was one of the authors of this, Practical Pediatrics. That's for sale for $160, and the last edition was quite some time ago, over 10 years ago. Then there's some other pediatric textbooks that are moderate size, not very thin and not really really thick, like Nelson Pediatrics, which is what I showed you before. Essential Pediatrics and Child Health, another UK moderate size textbook, which is $70. The point is, they're all as good as each other in terms of content. But I think these two, the illustrated textbook of pediatrics and Practical Pediatrics, the Australian version, is probably the best. And at some stage in your training, you need to read from the start to the end of a pediatric textbook and make notes and learn every chapter. That's something that's essential. And the earlier you start, the better you'll be at doing that. Remember, it's a marathon, not a sprint. You don't have to read it within a few months. You've got years to read it. And at the same time, you'll be doing opportunistic reading at various points when you see a patient with a particular problem, but you should also read a textbook from start to finish. I wanted to just talk about a few resources that are online on the Paediatric Society website. There we have guidelines, particularly Pediatrics for Doctors in Papua New Guinea. I'll just get that down and show you. If you haven't seen that book, this book, it's an excellent book. This is Pediatrics for Doctors in Papua New Guinea. You should try to get a copy of that. Again, an excellent book for both as a reference book and as general reading. It's particularly good as a reference book because it's very well indexed, and it has a page or two at most on any given topic. So it's easy to read, and it's very well indexed. It's not a comprehensive textbook of pediatrics, but it has everything that you would need to know about common diseases and common procedures in Papua New Guinea. So I would encourage you to get a copy of Pediatrics for Doctors in Papua New Guinea, get a copy of the Standard Treatment Manual. I'm sure you've got that, and Hospital Care for Children, the WHO book. There is online the DCH and excuse me. There is online the Diploma of Child Health and the Masters of Medicine curriculum, and that contains all the topics that we'll cover throughout the year and many others. There's many other resources too. There's the National Child Health Plan, which you should also read from start to finish. It's not a very thick document. It's about 100 pages. The National Child Health Plan, you should read that. And I also, on the website, are links to the pediatric lectures and tools for morbidity and mortality meetings that I mentioned before as being a good way to learn. In terms of treatment guidelines, as I said, on the website, there's the Hospital Care for Children book. There's a Pediatrics for Doctors in Papua New Guinea. We've also got guidelines, up-to-date guidelines on TB management, drug-resistant TB management, the up-to-date guidelines on HIV care, guidelines on child protection, pediatric cancer protocols. So go through that at some stage, again, opportunistically, and search through it, because you'll find a lot of information that you need to know as trainees in pediatrics. There are also on the website some education modules that can teach you about they're the modules that we use for the Hospital Care for Children program, which is a 4 or 5 day training program that we've done in many hospitals, but all the modules are there, and you can download them easily, and you can use them for self-learning, just going through each of the chapters in the Hospital Care for Children book. So that's something that you could do, either attend a Hospital Care for Children course during your training, and also look at the modules in the on the website. Excuse me, I'll just okay. I mentioned before that it's important a good way of learning is to review cases, and you can present cases at case review meetings, or you can be involved in your unit's morbidity and mortality meetings where you present cases and you try to identify the clinical lessons that have come from those cases, and you can learn about quality improvement. So I would encourage you very much to get involved in the M&M process in your hospital, and learn how that works. On the website there are documents about how to run child M&M meetings or child death review meetings, so we can learn as much as we can from those meetings. And it might seem a bit different to the learning that you need to do to become a paediatrician, but actually it's very important to be able to learn from morbidity and mortality cases, and how to do things better the next time is very important. Also on the website are annual child morbidity and mortality reports, and if you haven't ever looked at one of these, then I'd encourage you to download the latest one, which is actually 2022 is the latest one that's on the website. Please download the latest one and read through it. Again, it's about a 60-page document that has statistics from all the hospitals that participated last year and each year. So I'd encourage you to read that and read the recommendations for improved clinical care and public health of children that are published in that annual child morbidity and mortality report. I think all trainees should aim to present a case each month. You should present to your colleagues, you present to the rest of your unit, either at the M&M meeting or separate to that. And for that, of course, you've got to read around the topic and summarize the topic and identify the specific problems. And this is something that you should discuss with your supervisors about. Some hospitals create that opportunity anyway. Each week there's a case presentation, but if your hospital doesn't do that, then maybe suggest that to your supervisors, that each week, every month, you should have a case presentation where there's a discussion. I mentioned before about keeping a logbook. I think it's actually quite useful. There is a logbook also on the Paediatric Society website that you can download and use. Sometimes when people look at it, they feel quite daunted by all the things they need to fill in. Well, you don't need to fill it all in, but it's really a guide. It's a guide to the sorts of that you would aim to see throughout your training, the procedures that you should aim to learn, the courses you should attend, and it's a way of, it's like a diary that if you start now and then throughout the 5 years of your training, you keep filling it in from time to time, maybe once a week, or whenever you see cases, or you do something, have some thoughts about a case, then fill it in. Then I think it'll build up. You'll build up a comprehensive logbook that at the end of 5 years you'll be able to map your training. I think it's we got this idea from many surgical specialties, and anaesthetists, they all keep a logbook, don't they? They keep a logbook of their, the anesthetics they've given, or the surgical cases they've done. Well, there's no reason why we shouldn't also keep a logbook of the cases we've managed and the procedures we've done, etc. So I just encourage you to do that. Remember, it's a marathon, not a sprint. You don't have to have it filled in within a few months. The aim is to progressively build on it over the 5 years of your training. As I said, it's like a diary. It's your personal record of the things that you've done, the cases you've seen, the lessons you've learned. And I find it useful to do so because I can't remember everything. I try to remember as much as I can about the patients I've looked after, but it's also quite important to write it down so that you can look back and remember a case that had some particular variation or something that you learnt. Again, you're building knowledge slowly. One case informs the next. And when you see another case that's similar, you'll be able to say, well, I remember a case a year or so ago that was similar to this, and this is how we managed it, and this is what happened. You're building on knowledge. One case informs the way you manage the next case, and that's how you build up skills progressively over time. I think it's good to get used to learning from journals, and there is just so many journals, so many journals around at the moment. I would try to focus on just a few. There are too many to read, far too many, and many of them are not relevant. They're not very useful anyway. I would start with Archives of Diseases of Childhood. I think that's probably the most relevant journal. It's not so, the diseases that it covers include those that we see in PNG and the Pacific, but it also includes other things. And I think it's important that we have a broad view of pediatrics, and to learn a bit about what's happening in other countries. It's an international journal. I think it's really good, Archives of Diseases of Childhood. There's another one called Pediatrics and International Child Health, which is probably a little bit more focused on clinical aspects of pediatrics that are highly relevant to PNG, as well as the Journal of Tropical Pediatrics, which I think is now just an online journal. These three journals, I think, are quite useful to trainees and pediatricians to just every now and again read them. You can subscribe to the table of contents, and so they will send you an email every time a new edition comes out, and you can then scan through the topics, and there'll be some open access articles that you can access, and other ones you can just read the abstract for. I think this is a very good thing to be trying to do. So subscribe to the table of contents for one or two or three of these journals, I think. Okay, there is a way to access all of these journals free of charge, but it's only if your hospital or the university is signed up to HINARI. That's Health Information and Access to Research Initiative, that is a WHO initiative. If your hospital is signed up to HINARI, then you can get any journal. I think there's 14,000 different sorts of journals, different journals on HINARI. Remember, there's far too many journals to read, and it's good to focus on one or two. So two ways to do it is to sign up to HINARI, and you can find any paper you want, or you can just subscribe to the table of contents for Archives of Disease of Childhood, and then or Pediatrics and International Child Health, and you'll get a good up-to-date, I guess, understanding of what current research is and what's happening in pediatrics internationally. Recently I sent an email regarding the part 1, and I won't go through it too much today about the part 1, but maybe I'll just say a few things. I sent an email around regarding the assignments that you need to do, those who are sitting there part 1. I hope all of you got that. Remember, I wanted to emphasize a few things. The first thing is that we don't want very long essays. You don't need to write, for these assignments that are due about each month, you don't need to write very long essays. Somewhere between 500 and 1,000 words on a particular topic is enough, and to be focused on the question, that's enough. These assignments are supposed to orientate you to the topics that you'll need to read around so that you can be successful at the Part 1 examination, and also to teach you how to write well, and to write in a scientific way. So don't think you have to write extensively. For the Part 1, it's good to have a physiology reference book, and I think Ganong is the best one. If you look up Ganong now, I think it's up to the 17th edition, and that's quite expensive, $180, I think it is, or maybe a bit less, maybe $100. Almost any edition, any recent edition will be good enough. The 14th, 15th, 16th edition is okay, and you can probably get that much cheaper. I would try to get a copy of Ganong. You might be able to find it online. There might be some website you can find it online. This year, we're going to have some Part 1 basic science lectures incorporated into the DCH and the MEd lectures that I give every Monday. We might do them at the same time or a separate time, but I'm going to try to cover basic science in cardiovascular disease, basic science of respiratory, hematology, immunology, neurology, and genetics, the basic sciences related to them. And so I think it's the best way I can understand basic science is to apply it in a clinical sense, to know how it applies. And so I'll try to give some lectures that I'll try to record that are about the basic sciences, but linked to clinical issues. I find that the best way to learn basic sciences. And it also means that when you're seeing a patient at the bedside, you can refer back to the basic sciences, whether it's cardiovascular or respiratory physiology, and then try to understand what's happening to them. I'll be talking more about that. I sent an email on the 16th of January, which had the assignments this is for the Part 1 candidates. If you didn't get it, look back on your emails to the 16th of February. And we're going to have in the second week of February, so starting, I think, February the 12th to the 16th, we're going to have an introductory day for on pediatrics. And one of those days is just going to be focused on the Part 1 candidates. I think it's on the Thursday, the 15th of February. We'll just talk about Part 1, give Part 1 teaching, basic science teaching. I'll talk more about that, but that will be in Port Moresby from I think it's the 12th of February. Let me think. Yes, the 12th to the 16th. Okay. Now, that's about the content of the course. It's about the structure of the course. I just want to say something about supervisors and teachers and mentors. All of you have a clinical supervisor. That's the SMO that's supervising you. They oversee, support, instruct, teach, and assess you in some ways. And your supervisor might change depending on which hospital you're working in. If anyone feels like they don't have a supervisor, I think it's very important now we identify that and make sure that you do have a named supervisor. This is very important. A supervisor is often your teacher. They teach you in different ways, in formal and informal ways. I also think you need to have a mentor as well. It's a bit different to a supervisor who fills in the paperwork and helps assess you and supervises your clinical performance, etc. Supervises your clinical decisions and that sort of thing. A mentor is a bit more supportive and advisory, and it may be your supervisor. It could be an experienced pediatrician who's your supervisor. It could be a recent graduate. There's some young pediatricians who've just graduated who may not be supervisors yet, but they'd be very good mentors to have. I think someone who's a bit closer to your age or your stage in training might be just another trainee who's maybe even in another discipline. You might have a mentor who's an anesthetic trainee or something, a junior anaesthetist. The point is to have someone that you can identify with, who can help you in advisory and supportive relationship and help you along the way. Again, they could be a supervisor or they might be someone different. And so I'd encourage you to try to identify someone who could be your mentor throughout your training and help you along the way. The thing about a mentor is that and a supervisor is that they should be interested in you not just for your work performance, but also they should be interested in you as a person, how you're going in pediatrics, how are you coping with things, because we all have times when we're doing well, and we all have times when we're struggling a bit, and I think it's important that you have people to support you throughout all of those times. Now, lastly, this is my last slide. I won't go on any further, but I just wanted to, I've said this 2 or 3 times throughout this talk, postgraduate training is a marathon in all disciplines, not just pediatrics. It's a marathon. It's not a sprint. And you don't have to do everything at once. You should take your time, and you should be kind to yourself and kind to other people along the way. You have to, all of us have other important people in our lives and things in our lives that we like to do, whether it's family or friends, especially we have family, we have responsibilities too, and we all understand that. This is very important, and it's part of your, it's not like you're in school anymore. This is postgraduate training, it's adult learning. You need to take time to look after yourself and look after the other important people and the things in your life that you really value, and you need to be happy and enjoy your training. Now, I think sometimes pediatric training and other disciplines as well can be pretty tough. They can be sad and they can be confronting, and sometimes you might even doubt yourself. Many people, sometime during their training or even when they're junior pediatricians, they doubt themselves that they're good enough. But, well, you will be good enough, but sometimes you just need to be a bit kind to yourself and realize you need to sometimes you'll need to take a break to deal with other issues. We've had many people who've be going through the training program, and they've decided to take a year off to look after their family or to lots of different reasons, to provide care to a parent, to an elderly parent who might be sick, or to look after one of their children, or just to take a break and do something different. That's fine. Many people have come back to pediatric training and made a real success of it when they come back. So don't feel you have to do it all at once. But just take your time. You've got 5 years to do it. And I think that, it's hopefully you won't feel like this, but for some people who do feel a bit down along the way in their training, make sure you know that this is why you need a mentor, and make sure you know that you've always got someone else you can talk to and look out for you if things are a bit tough because you're being stressed by exam pressures, or stressed by other things outside work, or stressed by a child who's just died. These are things that are a bit confronting to all of us, and especially people who are relatively inexperienced. And I'd encourage you to find a mentor who can help you along the way. Okay, that's all I want to say. I'm just going to stop sharing, and then maybe I might just show you if you haven't seen it before. Hope you can see that now. I'm showing you a YouTube website, a YouTube channel, and I mentioned before that all the lectures that I gave last year, almost all, I think I missed 1 or 2, are on YouTube, and you can download them and watch them. So for last year there was 30 lectures, and before that we can go right back to 2022, and you can see that 2022 there were 28 lectures. So I'll be giving many of these again this year, and I generally update them and modify them along the way. So it actually is helpful if you've looked at them in the past to do some pre-reading and pre-learning, and then come to the lectures if you can, and you'll get more out of it. So I just want to say that that might be helpful for you to do at some stage. Certainly, if you miss lectures, then go back and have a look at these ones online on YouTube. Okay, that's all I want to say today. I'm going to stop recording and